Don't ever eat 3 things Roman noodles, period, because you're going to go into freaking hypernatremia. Alright, let's see. Let's get started with our review. Alright, everybody ready? Let's go. I didn't get to finish eating my fish. Okay. Where is lab group 1? Pick one for you. Put 1 on your little clicker. Lab group 2? If you're lab group 1, you press 1. If you're lab group 2, you press 2. If you're lab group 3, press 3. Lab group 4, press 4. Lab group 5, press 5. Lab group 6, press 6. And lab group 7, press 7.
Is everybody in the group doing it?
Yes, everybody in the group does it.
Hey, what numbers are these?
You'll get back there with your group?
No.
So you're going to have conflicting answers, which means you're not going to have a good score because you two are going to choose something and then you two are going to choose something, which is going to cancel each other out?
Yeah.
Okay.
We got FaceTime or something.
Telecommunicating? ET, phone home? Okay. Everybody ready?
Turn around and ask questions.
Team 1?
Yeah, Hillary's not here.
That's right. It's group 2, 1 and 2 that are down. All right, group number 1, pick something.
Whoa. Cardio review 200.
Cardio review 200. All right, you got time to think about what this is. And what is the primary treatment for this?
Can we just tell you?
What is this? And think about the primary treatment. I basically click it over. I just want to make sure everybody can see this. Everybody got this?
Is that only one group answering or is that all groups answering?
All groups are answering.
Oh.
That's why you chose what group you were in so that you could coordinate with your group to see who gets the highest points, who gets the answers correct. But I mean, y'all can stay there if you want to and just cancel each other out and your group's going to have 0 points. I guarantee you, y'all are going to choose something different than what they're going to choose.
Hey, Brandon.
Is it not for a grade?
Mm-mm.
Okay, well, it's not, right?
Do I need to make it for a grade to get you to participate?
No.
Are you sure? Because I'm thinking that because you ask me that every time. Is this for a grade? Is this for a grade? Makes it mean you're not going to participate.
Hey, I'm doing good to use the clip.
Are these 6 taking strips?
Yes. What is the primary treatment for the strip that you saw?
Patient symptomatic?
Yes.
Who answers? Everybody?
Everybody.
Oh,
Is this our first time we played Jeopardy?
Yes.
Is it really? I thought we did it before.
No.
We played the
We haven't played Jeopardy yet? Okay, I'm sorry, y'all. This is how good Jeopardy works. I really thought we played this before.
What is?
You don't have a camera on the front, Betty, so you can't ever All right, the way Jeopardy works is we go from group to group. With that group, you should choose what question we go to. Then everybody gets to answer it. At the end, your scores are tallied, and we get to see which group is a rock star and which groups are not.
So we don't know until the end?
Then at the end. There are 2 daily doubles. No, your education is your bonus point.
So you keep it for your education.
It keeps score for me.
It's like saying the book is your study guide.
It is.
From the teacher that doesn't have the PowerPoint.
Huh?
Nothing?
No, I don't use the PowerPoint in the book. Sorry. You should like that about me.
I do.
All right, is everybody done? 26 in? Y'all are so smart. Everybody got that one right. All right, group number 2.
Oh, we don't get to say that?
You did it. Everybody got it right.
Oh, I didn't say. I'm sorry.
Oh, it's okay. Everybody got it right. It's actual
with
team.
my group. He was judging a fee.
We want miscellaneous meds, 200.
All right, miscellaneous meds for 200. EMS is called the home of a 29-year-old male patient with diabetes. His blood glucose level is 29. He is unresponsive and has a 20-gauge IV, which is established in his left AC. What medication and dosage should be given? Everybody go with what's on the board? He's 29 years old, has a history of diabetes, blood sugar is 29. He's unresponsive, has an IV access. All right, what medication are you going to give him?
It'll be okay.
Good job. Dextrose, 50%, 25. Who would get 25%? Who gets 10? Infants. right, what would you give glucagon? You couldn't get an IV access. How much would you give? Where would you give it? IM, where? In the arm. It's 1 milligram. You can give it in the deltoid. There's no point in exposing your patient if you don't have to.
Yeah.
That's it.
Whoa! Come on! That wouldn't even be. You were thinking, man.
You too? Group number 3.
Miscellaneous without.
Woo! High roller. All right. This drug is given during a hypoglycemic episode. It can also be given to help with foreign body obstruction in the esophagus. Name that drug in correct dosage and correct route. Can be given during a diabetic episode. Also works as smooth muscle relaxer and can be given during foreign body obstruction. Esophageal foreign body obstruction. Smooth muscle relaxer also helps with hypoglycemia.
So if there's somebody right here, can you give them that? Because their breathing is fine, because they're not coughing or nothing, but it just feels like it's stuck right there.
Still stuck in the esophagus. Helps either go down that way or come out the other way.
Ever since you told me that, I really just want to go get bottles of glucagon and have them at the house.
I can probably just tell everybody that's the answer.
Sorry.
But I'm proud of you for remembering that.
Well, I have a phobia of choking.
She would overdose. She would
I would definitely overdose on that drug because I have a very bad phobia. If I swear to God, if I ever get a choking patient, I'm going to end up freaking out. I'm going to have an anxiety attack.
Choking is a very difficult thing to deal with. But if they are able to cough, they're fine. All right, there's still one person that hadn't answered. There we go. Correct answer is glucagon. We just talked about this too, which is kind of funny that she picked that slide. Correct answer is glucagon 1 milligram IM. 2 is too much. It is not given IV. It is given IM only. I have never seen in my 10 years of being a nurse glucagon given IV ever. It is given IM always. And the same dosage for a hypoglycemic patient is also the same dosage for someone who has a foreign body obstruction to work as a smooth muscle relaxer. That's one of those things about the drugs, and registry is really bad about that. They don't test you sometimes on the drug itself and the routine things that you give it for. They do kind of ask sometimes off-the-wall things. What I've been told,
Like that.
like that. Because glucagon is a smooth muscle relaxer, and you don't really normally know that about it. It's like atropine. A synthetic form of atropine is bentyl, which is used for abdominal cramping. Kind of funny. That is good to know.
Are they able to swallow this stuff right here?
Huh?
Are they able to swallow it?
They can, and the glucagon will help relax the esophagus because your esophagus is a smooth muscle, so it kind of helps relax it so it can either go on through. Sometimes if it doesn't go on through, then they take them to endoscopy and pull it out.
Yeah, but I mean, they can't eat nothing or nothing.
No, they
Like,
can't.
They can't swallow everything that's swallowed.
Everything they swallow comes right back up. Group number 4.
We gonna do.
Respiratory diabetes.
We're 1 million.
All right, EMS is called to an MVA with possible head injury. Medical direction orders you to RSI prior to helicopter arrival. Which medication would be most appropriate to use for sedation? Choose the correct medication and the correct dosage. So your patient is an MVA with a possible head injury, wait on helicopter arrival, and you have to RSI. What are you going to give them first? First. The correct dosage and the correct medication.
Oh, it's not open.
Where'd my thingy go? Oh, it's not. Where did my? That's not making sense. Where's it at?
Can you go back?
All right, we're gonna do this.
Oh, break it.
What is this?
What group thinks it's answer number 1?
That's everyone.
All right.
Nah, everybody looks like the same.
Who group thinks it's number 2? All right, tell me what group numbers you are. Number 5.
Would be
Number 4. Group
Number
4.
4,
6.
2.
1.
All right, group number 7. Which one do you think it is? You think it's 4? Okay.
This is like way against the crowd there. What's wrong?
All right.
Everybody's right.
The correct answer is 2.
Hey.
It is etomidate. That is the correct dose range for etomidate for an adult patient. How much is the typical adult dose of etomidate?
20.
Why wouldn't you give ketamine?
Because you can't give it to them.
You don't give ketamine to somebody with a head injury because what does it do to the intracranial pressure? Increases their intracranial pressure. All right, why wouldn't you give lorazepam? That is a lot of lorazepam. First of all, that dose is not even nowhere near correct. Lorazepam is what, 1 to 2? Correct? All right, so we wouldn't even think about giving lorazepam because it's way too much. What about diazepam? Why don't you give that?
That's the wrong dose.
That is the wrong dosage for Valium. How much Valium would you give? How much do you give for cardioversion? 5 to 15 titrating to effect. You do the same thing for RSI to sedate somebody. So that 2 milligram dose of diazepam is not correct. So the only correct one up there is etomidate 0.2 to 0.6 milligrams per kilogram. And the appropriate dose of that is about 20 milligrams. I don't know why that didn't work. I'm sorry. All right, group number 5.
Still cardio 1.
What is the treatment for this? Think about what this is. Primary treatment. Ready to go back? Hold on, I can turn it back on. It's okay, don't worry. All right. Let me open it back up. All right, it's back open. Primary treatment for the rhythm you saw on the screen. Patient had a pulse.
If they're unstable, the answer's not up there.
If they're unstable, the answer is not up there. That's correct.
So we're assuming they're
So what is the best possible answer? It's another registry trick for you. What's the best possible answer? Are you ready? Oh, that's so smart. Everybody chose number 2, which was adenosine 6 milligrams. If that doesn't work, then they get a follow dose of 12 milligrams. Everybody got that right. What if they're symptomatic?
synchronized cardioversion.
Synchronized cardioversion. And if you got time for some Valium, please give them some Valium. That's going to hurt. If they have time. If they go unresponsive, yeah, no, they don't care. All right, listen up. Group number 6. Which medication can be reversed by flumazenil? All right, flumazenil. Ready to go with that? Which one of those medicines is it reversed? Flumazenil. Are you looking it up? Oh, that's good. FLUMAZNEIL. Thank you for not taking it, Cameron. Yes. That is an antagonist. I'm taking it, Cameron, because he cheated your fan to you. Were you not here for that? Oh yeah, are y'all cheating with your laptop? Close your laptop. What are you doing with your laptop?
I'm trying to cancel my Hulu subscription.
Thank you for being honest. Close your computer. What are you doing?
He hadn't done anything.
Close your laptop. Everybody close your laptop. You can take notes physically writing them if you need to.
Well, let me cancel it. They got my credit card.
Close your laptop and get after class. Don't bring it to me. All right. Woo. What is flumazenil? It's a reversal agent for a benzodiazepine. Which one is benzodiazepine? What reverses Narcan? Or what reverses morphine? Narcan. Correct answer is lorazepam.
Morphine will also reverse Narcan.
Yeah, no. That's like cerebral spinal fluid does not have blood in it. Okay? right, group number 7. What do you guys want? Okay. Cardiology 4,000.
I always say torso.
You're not the only one. There's a lot of people that do that every
Normal
semester.
sinus, he says torsades.
Normal for
You just want to see a torsade, don't you?
I really do.
I've never seen a torsade.
Neither have I. I really want to see it.
I wonder how many medics have actually seen torsade.
Seen it on the floor.
2 minutes.
My dad says he's never seen torso.
Okay, cardio 1,000.
Let's go.
What is the primary treatment for this? Everybody go with that with that slip? All right, what's the primary treatment? And somebody asked me if they're stable or unstable, I'm going to throw something at you. Because you can't have stable that.
What would you
Do
do
they have a
first?
pulse?
I don't know. This is
No, they do not have a pulse. You never have a pulse with this, ever. These patients are never stable. They never have a pulse. There are 2
They're
right
That's what I'm
answers.
saying.
primary treatment.
Primary treatment, according to your book, is what?
It's still 2 answers.
If
It
you
says you
had-
can replace.
What do you do
You
first?
can replace the first
So
or the
that's still
second.
primary.
The best option for you is yes, a state first goes over your
Yeah, no. We're not even going there.
So what do y'all want?
Just follow the pattern. Two people that answer.
Torsades is up there.
Aldra!
I'm being honest.
Quit it!
At some point, you gotta start lying about it.
At some doggone point, really? All right, it is correct. Hunter is right. You can give vasopressin for the first or second dose. But primary treatment, you want to give epinephrine. Okay? Primary treatment, you want to give epinephrine. You can replace the first or the second dose, but who replaces the first dose with epinephrine with vasopressin?
Not this guy.
Not this girl either.
Gary does. Can you explain why? Nobody else can explain why. Yeah.
Vasopressin is the only thing you can only give it once. You don't have enough time to give it more than once. And you always want to try with epi because you try with the smallest thing first.
Thank you for
Well, Mr. Tim says
You're welcome.
that.
I hope that explains it for you.
Miss Curry
You always want
says.
to try something. Vasopressin is one of those drugs you can't give more than once out in the field, so you want to try something first. Whatever reverses this, the patient's going to have a drip. You're not going to hang a vasopressin drip. You're not going to hang a pressure drip out in the field because you have so many. How many minutes is it? 20 minutes before you can do another pressure.
Or
So
8.
you want to start with, or what?
Or 8.
Or 10.
Tim said you got 8 minutes, you're good.
It is a 20-minute time window. You don't. That's one of those drugs you don't mess with.
You're in the TV department at
But you
Walmart.
can
You
get
got
everything. Correct. You can get anything else on this pressure. Okay. Is everybody good with that? You always start with epi first. If epi doesn't work, then of course you want to try something else. That's when you try vasopressin. And then you go back to epi. Because whatever reverses this, you're going to have to have a drip for it. And you can do an epi drip out in the field. You can't do a pressure drip out in the field if you give vasopressin. Okay? You're good?
We're good. Good.
I'm good.
Give vasopressin to get control.
All right, group number 1. 7, didn't y'all win? Y'all just went? Yes, he did.
Electrolytes 4,000.
Huh?
Electrolytes 4,000.
Electrolytes for 1,000. All right. Ooh, this is a hard one. This is a hard one. You ready? This drug is in pregnancy category A. So what does that mean? It's good. All good, right? All good. It is used to treat a variety of illnesses. So there's many different things that this one drug can treat. Calcium can be used as an antagonist if needed. What does that mean? What do I mean by antagonist, Aldra? Reverses. It blocks. Agonist means it has the same effect. If it's an antagonist, it blocks it. Okay? So calcium can block this. It is given 1 to 2 grams over 1 to 2 minutes in a cardiac arrest. It also works as an anti-inflammatory. So it has a lot of different properties, a lot of different ways it works. Which drug am I? There's probably a lot of drugs up there y'all don't know what they are.
Calcium.
Calcium can reverse it. You need to think about it. All right, one person had answered. Okay. Who chose Salumendrol?
Ron did.
Ron
picked Salumendrol.
Really?
Well, it's our score.
Why would you pick Salumendrol?
The anti-inflammatory.
It is an anti-inflammatory. What's it used for?
It's like.
Who knows? What's Salumendrol used for? Asthma, for patients who have reactive airway disease, COPD, asthma, bronchitis, anything that causes inflammation in the lungs, Salumendrol is going to help with. And they do give that in the hospital setting. The correct dosage for Salumendrol, however, is 125 milligrams. Yes, to help with inflammation. So I can see why you would choose Salumendrol because it is an anti-inflammatory, but calcium does not reverse it. The correct answer is magnesium. What gave it away for you? I didn't think that was thought.
You said something.
Pregnancy category A. Because magnesium is used during pregnancy. What is it used for? For eclampsia, right? Whenever they start having seizures. That's eclampsia. It can also be used for preterm labor. It is used during cardiac arrest for somebody who's in torsades. Also used for patients who have a low magnesium level. And calcium is the antagonist for magnesium. Huh? That was Deason's reason? Because calcium? All right, number 2. Who's group number 2? That's you. Okay. This is a bronchodilator that is used in the treatment of bronchospasms. Name that medication and the correct dosage. So this medication is a bronchodilator used in the treatment of bronchospasms. What medication is it and what is the correct dosage?
We thought we all knew the last one too.
That is correct. Albuterol, 2.5 milligrams.
Y'all didn't give me an answer.
Number 3? Who's group number 3? Y'all are. Pick one. All right. This patient is alert and oriented. They complain of an uneasy feeling in their chest. He is a 49-year-old white male with no past medical history.
I was thinking 49-year-old woman. He is a 49-year-old woman that WM. I was looking at it like,
No.
that's somehow.
His pulse is 192, BP is 100 over 60, respiratory rate is 20, and his O2 set's 98% on room air.
Oh, yeah?
Are we ready for me to move on? What would be the primary treatment for him? He's somewhat stable, so medically, what would be your primary treatment?
Is this on Canvas, Brandon?
Nope.
You recorded it.
I'm going to put it on Canvas. It wouldn't go on yesterday. For some reason, we're having problems putting stuff on. That's why I didn't put it on yesterday afternoon. It wouldn't go on. So I'm going to try to put it on when we get done in class. All right, come on. I'm fixing to click it so you better answer. The correct answer is amiodarone, first dose of 150 over 10 minutes and repeat as needed. If they are in cardiac arrest, that is the only time you give amiodarone 300 first, then 150. So a patient in stable ventricular tachycardia, now with me, stable ventricular tachycardia gets a dose of 150 of amiodarone.
Yeah, that 2.2 milligrams, that threw me off.
That's what threw me
That's a
off.
max of 2.2
If
over
you come
24
to
hours.
Dayville with that rhythm, you get 300 Amarillo. Just
Do
say,
you have a first dose of
Stable or not stable?
stay, we're not stable.
Why would the max be?
We're gonna fix, okay, let me ask you a question.
No, don't go there.
You give 150, how's the max 2.6?
Yeah.
Wait, that's supposed to be
Yeah.
per kilogram, I think. I'm sorry.
Then it's
That's
wrong.
why it messed me up.
Shut up.
It's 2.2 milligrams.
But it's supposed to be right, so it's okay.
That's right. It's supposed to be
So
right.
it is incorrect.
I need to change that on my slide. What slide was this? All right, I will fix that on the slide. What slide was that? Cardio what?
800.
800.
We all agree. Except that 1%. That's a lot.
All right. Group 4.
Pain 800.
Morphine.
All right, a 49-year-old male overdoses on MS cotton. What medication can you give him, excuse me, to reverse the effects? Overdoses on MS cotton. What are you going to give him? Naloxone. What's another name for naloxone? What's the dose range for naloxone? No. Hunter. Hunter, look at me. 0.4 to 2.
So it's no longer 1 to 2?
It's 0.4 to 2.
Was it ever
It's
1 to
always
2?
been 0.4 to 2, and me and Nick actually had this conversation when I taught advanced CMT, because every year that I've taught advanced CMT and taught pharmacology for advanced CMT, Narcan's always been 0.4 to 2. Are you okay? But the advanced book has 1 to 2. So, and he told me one time, I believe that, I know. I believe he told me that we had to teach it the way the advanced book had it, and paramedic is taught differently. I've always taught it as 0.4 to 2. I've never taught it as 1 to 2. I had some heartburn with that
I just
one.
think that advances can't do that math, so they just give them an easy cut number.
There you go.
I want an easy cut number.
Wait, we're all taking
No.
the advances in here.
They're so much higher.
Why do you think you do a math number?
The thing with that book, though, if you look at protocol actually tells you 1 to 2. Nobody ever gives 0.4. But registry standards, according to the registry standards, is 0.4 to 2. All right, who's next group ready to go? 5? Is it 5? Miscellaneous for 800? It's a daily double. I really want sound on here, but I can't ever get sound. All right, what percentage of your current points would you like to wager on the next question? You're not going to know the question after you wager. All or nothing? You never know.
Go figure, go home.
How long did it take you to create this?
It takes a little while. But I like teaching this way. I love games. Some people don't like it. I like it. Well, it doesn't matter. Audra don't really care anyway.
No, she's not finished.
All right, only 17 people have responded. Y'all get to it. Pick a number.
I just don't like games at all.
So you don't like my teaching?
I just don't like games.
That's
I
what
like
she
your
said.
teaching.
That's what she's saying, isn't it? That's kind of how I feel.
Go preschool because I don't like to play games.
I can definitely get up here and lecture off some PowerPoint slides all day.
I'm down with that.
All right, one more person.
I feel like I learned better off.
Everybody clicked? There's still one person that hadn't clicked.
I did. I promise, I swear to God.
There we go.
I clicked.
All right, your miscellaneous daily double. What type of drug is that? All right, know this word, okay? What is that?
I'm not saying it because they don't know.
What type of drug is it? Ooh, that's hard. I gotta lose your points.
Yeah.
It's kind of funny because in the book, in the medication section of your book, it tells you, right under the name of that medication, it tells you one of these things.
Can we look at our book?
No, you can't. Good, nice try though. I mean, I give you some effort. I probably should let you look at it since I threw some punch. I didn't mean to hit you, I promise. I like you. I didn't mean to
What
hit
are you
you.
doing for your birthday?
I heart you, Brandon.
My arm still hurts.
Good old boys.
But I ducked because I figured it was coming.
I didn't mean to hit you. All right, here we go. You ready? It's two!
Everybody got it!
Smart!
You're the one you always say, like, I can't say that word. Just say I'll be right.
I can't ever say that word. What was that? Atrovent. Atrovent. It is an anticholinergic and a bronchodilator. Y'all are so smart.
So that means we just doubled because we did 100.
You just doubled. Woo!
That everybody in the room did the same thing, so it doesn't.
All right, so yeah, everybody did the same thing.
Don't even worry about that.
Well, this is now plus 2,000.
Wait, but what about the wager?
This is now, everybody wagered the same thing, didn't they?
No.
Yeah, they did.
So we're negative.
All
This
right.
is gonna have to stay 1,000 because
Just
everybody
leave
got
that
it right.
alone.
No, because we wagered 100% of our points. So that's
Yeah,
why
we
we
back
definitely
off.
daily
I've
double.
wagered 100% of my points too, and I want my points.
Yeah.
So right percentage.
All right, well, who wagered what? I can't tell who wagered what.
We got
So I'm gonna lie.
Oh my God. That would not matter.
It's not gonna matter.
Say they wagered all or
It
nothing.
really is not gonna matter.
Okay.
It's not gonna matter.
That was-
All right, who's the next group to go? Number 6?
If at the end of this game it says you're all
Brian?
winners, Brandon, your name is game.
Don't care if I lose, just don't want us all to win.
All right, this drug is given to patients who are hyperkalemic or have overdosed on labetalol or verapamil. It can cause asystole, therefore monitor their heart rate with administration. So, they're given to patients who have hyperkalemia and are on overdose on labetalol or verapamil. Can cause asystole, so you got to monitor their heart rate. What drug is it? Given to patients who have hyperkalemia, overdose on labetalol or verapamil.
That's what I think.
I'm close with that.
Yeah, I know that.
All right, I got 5 more seconds to answer. Thank you.
What's right?
Correct answer is calcium chloride.
We went bathroom break.
In just a minute, yes. Let me talk about this, then I will take a break, okay? Calcium chloride is given to patients who have hyperkalemia, which is what? High potassium, so it helps bring the potassium out of the cell. All right, and also be given to patients who overdose on labetalol. What's labetalol? Labetalol?
Beta blocker.
It's a beta blocker. What is verapamil?
Uh,
Calcium channel blocker. Okay? It can cause asystole, so you got to monitor their heart rate really, really, really closely. Sodium bicarb, we're going to talk about that one in just a few minutes. We're going to talk about that one just yet. All right, y'all take a break for 5 minutes, go pee, and then get back because we still have to finish this and take a math quiz before you're done. All right, we're getting back started. All right, what group is next?
We were.
All right. Group 7, that's y'all. Yeah.
Miscellaneous medicine.
I think someone else has to apply.
All right, medications for 6, miscellaneous. This medication is an osmotic diuretic and is used for cerebral edema and to help reduce intracranial pressure. What medication is it? It's an osmotic diuretic and is used to reduce intracranial pressure. What is it? Osmotic diuretic used to decrease intracranial pressure.
Wow.
Correct answer is mannitol, number 2. Mannitol.
Do you know the dosage of that?
I do not know the dosage of mannitol off the top of my head. I'm sorry. I don't know the dosage of mannitol.
Is 4 even real?
Is it 1 to 1.5? 1 to 1.5 grams?
Come on.
Sam says it's 1 to 1.5 grams.
Because one of them is 1.5 girls.
The furosemide is that one.
Or Lasix is a small one.
Yes, Hudson.
Is 4 a real drug?
4 is a real drug. It is,
It's when you're constipated.
I'm there.
This book says different.
it's a steroid, but I can't think of what it's called.
Mine said 1.5 to 2 grams.
That's solumedrol. That's the generic name for solumedrol. Methylprednisone, sodium succinate.
Let's get that word in it.
4 is a real drug. It's solumedrol.
Those gums on that here.
All right, group 1.
Cardiac review, finish it off.
What is the treatment for this for a patient who has a pulse?
B.
It is different if they have a pulse versus not having a pulse. The dosage is different. So they have a pulse. What do they get? Tyler's cardiology refresher was changed to April the 23rd at 1 p.m., which is a Wednesday after class at 1 p.m. So if you want to go, I'll pass this back around.
When did you say?
Wednesday, April the 23rd at 1 p.m. If you can't go, we will record it. It's going around.
We don't do it. We're not doing it.
Cardiology refresher, Tyler's cardiology refresher he was going to do Friday is moved to April the 23rd, which is a Wednesday at 1 p.m. All right, 2 more people. Let's go.
Wait, there's not one of our classes, right? That's
Nope. Yeah, that's why we're helping. That's why we're not doing anything. Does that make sense?
We expect to have help on Thursday.
Yes.
I'm not ever.
Yeah, you are. 1 more person who had answered. 5, 4, 3. Thank you. Correct answer is 1. Magnesium 1 to 2 grams in a 50 to 100 milliliter D5W over 5 to 60 minutes. Followed with, that's your loading dose, followed by maintenance infusion. Group number 2. What electrolyte imbalance causes this? What electrolyte imbalance causes a peaked T wave? Which electrolyte imbalance causes a peaked T wave? mannitol is 0.5 to 1 gram.
I'm telling you, you're right.
I get a sticker.
I get a sticker.
I have stickers in my office somewhere. I'm going to find them and start giving them out. I'm just going to start giving out stickers. All right, 5, 4, 3, 2, 1. Everybody? All right, the correct answer is hyperkalemia. One person in some group didn't answer, so it's going to affect your points.
Just so you know.
Hyperkalemia. You'll do anything for a sticker, Jefferson?
Whoa.
We're not even going there.
I'm talking like vacuum the floor. What are you disgusting, man?
But washing the toilets in the bathroom.
Clean the sink.
Number 3.
Pain management for sick.
Another daily
You
double.
gonna count this one?
Wager your points.
It don't matter. It don't matter.
Huh?
You gonna wait? I mean, does this wager even matter?
Yeah. It did too count last time. Pain. It counted last time. It went to your points. The only thing that didn't count was that one question.
Wait, are these actual points that are going to go in there as 9,000 points in pharmacology?
Yeah, sure. All right, answer.
I'm doing it right now. I don't know what you're
5, 4, 3.
Hey, I'll take that one.
What is the adult dosage for fentanyl?
Oh, God. Retract the previous
What is the adult dosage for fentanyl? Adult dosage for fentanyl. Adult dosage for fentanyl.
Sam, quit looking.
Why is your laptop open?
She's so sad.
Why is your laptop open?
I got the schedule pulled up so
Thank
I
you.
can see if I can get those.
She exited out of the screen.
You think she'd really do
Actually,
that?
want me to do your answers. I'm probably going to be wrong.
Whoa. You're right. You're mean.
One more. Let's go. Answer. Thank you.
I'm mean.
That's the hardest question on there. It's 600. Good God. We all got to read.
It don't count.
That was pretty funny. I like that. The correct answer is 1 microgram per kilogram for fentanyl. Wow. All right. Group number 4.
That's 4 for 600.
We lost them.
We gotta make a point.
All right. What is the adult dosage for rocuronium? Adult dosage for rocuronium.
You got 2 controllers.
I do, but it doesn't matter.
Give Audrey back her controller.
It's not mine. I literally I've had 2 the whole time.
See, I'm actually doing better.
It's about time. You know, we still haven't done Apex Domain. I'll let Brittany tell you.
Is that where you can count? As a student, complains when there's something that they absolutely have to do. That's what's going to go down.
That's what we Sam. And she left Children's Expo without telling me.
I couldn't find it.
I don't
I waited
care.
for 15 minutes.
Not an
You
excuse.
know, I bet that you have your 10 points from it.
I do.
Well, I
She does have her 10 points
for
from
an
it.
hour and a half, 2 hours, whatever long, and I think I was 10.
Well, her actually, that was my mistake because her grade will change.
Thanks, Brandon.
Yes.
There you go. Is that wagering all the points you accrued for the whole game or just the points for that question?
The points you've accrued for the whole game.
So we have
0? All right, there's 2 people still hadn't answered. What's the correct dosage for, thank you. 0.6 to 1.2 milligrams per kilogram is the correct answer. Are we going to have some negative points in here?
Back up. How many points is that? 600?
Huh?
How many points is that one worth?
600.
Yeah, we're.
All right, next, group number 6. Is that where we are? 5.
Yeah, you skipped us twice. I mean, you keep going.
I'm so sorry. I didn't mean to, I promise. Y'all are just too quiet. Y'all speak up.
Miss Laney's 400.
Thank you.
You know your thing.
I was gonna say, she forgets group 4 all the time.
Can you blame me?
Oxygen.
All right, miscellaneous. This is the antidote for cyanide poisoning. Can cause headache and increased intracranial pressure. Can also cause hypotension in patients who have beta blockers and have had alcohol use. Y'all know what ETOH is?
Yes.
Alcohol use? Okay. Cyanide poisoning. It's not the cyanide antidote kit. That would have been too easy.
Yeah, I
Oh,
mean,
yeah.
why is that not?
There's 2 drugs listed in your book that treat cyanide poisoning. There are 2 drugs. All right, 2 more. Let's go. Correct answer is amyl nitrate.
That's the only one I've seen on there.
I don't even remember what 4 is. Huh? I do not know the dosage for that. I don't remember off the top of my head. I'm sorry.
2 to 4. Not everything is.
About everything. Or 1 to 2.
You just give 2 to 4.
All right, group number 6. This is an NSAID in the form of an IV medication. Normal adult dosage is 30 milligrams. It is not given to patients with a GI bleed. Elderly patients need smaller dosages. It's an NSAID. Typical adult dose is 30. It cannot be given to GI patients. What is it? Morphine's not an NSAID either. All right, 4 people. Correct answer is Ketorolac. What is Ketorolac?
Toradol.
Toradol. The correct answer is Toradol. Toradol is like an IV form of Motrin. It is an NSAID, so we don't give it to GI bleeders. Why? It causes a lot more bleeding.
How do you pronounce that?
Ketorolac?
No,
Toradol?
no, the N.
The N? NSAID?
Not insane.
Shut up.
Insane.
You're on my hit list. Hush.
No, he's not. I am.
Glad I called
I
that
have
guy.
bad aim. Huh?
Glad I called that guy.
I'm not.
Yes.
Never seen Billy Madison.
It's an NSAID. NSAID is a non-steroidal anti-inflammatory drug. Think of Toradol. It is like an IV form of Motrin. All right, let's go with Respiratory 400.
Cybentrol is a steroid, all right?
You even get the
Crap.
It is.
Crap.
Which medication
Maybe it goes that way.
Benadryl.
All right, EMS has called the home of an 18-year-old male who complains of pain and swelling due to his left hand from a yellow jacket sting. His vital signs are stable and he's not having any difficulty breathing. So which medication is the best choice for him?
Not suppository. I had to do that in the ER. God.
Let me phrase this a little bit differently. It's something you can give on the ambulance. Just go ahead and say that right there. What are you going to give him?
Number 2.
Are you sure?
My nephew up there.
He's not having a severe allergic reaction, so he doesn't need
He's
it.
not.
Correct answer is 25 milligrams of IV Benadryl.
Is that the end of it?
No.
She hit the wrong button.
When? In the summer?
I mean, no, his cardiologist is starting right after cardiology.
It starts at 1, yeah, so you'll be able to get down to cardiology, go grab some lunch, and bring it back. Yeah, we won't start. We'll let you have break time to go grab some lunch and come back. All right, pain management for 200. This medication is an antipyretic and a mild analgesic. Overdose can cause liver failure. Max daily dosage is 4,000 milligrams. It's an antipyretic and an anti-inflammatory. Used for help with mild pain. Max dosage is 4,000 milligrams. 4,000 milligrams, excuse me, not heavy. 4,000 milligrams. It's a max daily dosage.
I guess I need to do prior fever.
2. Good job. Correct answer is acetaminophen, which is also known as, thank you, fever reducer. This is a vitamin B1 administered IV given to chronic alcoholic patients who are malnourished. Name that medication and the correct dosage. Vitamin B1 used for chronic alcoholism or malnourishment. Name the correct medication and the correct dosage.
Solumet, bro.
This is so long.
Whatever the heck.
It'll crack me up. Correct answer is thiamine 100 milligrams IV. Thiamine is not given IM, and it's 100 milligrams all the time. It's never 10. It's always 100. What is Sodalol? You might know? How do you know that?
Oh,
The wow. So
This is
smart.
when their heart stops beating.
Electrolytes.
Because it reduces heart rate. That's the way to think about it. It reduces heart rate. All right, EMS is called the home of a patient who's overdosed on a tricyclic antidepressant and aspirin. Which medication is the most appropriate to give them? They've overdosed on tricyclic antidepressant and aspirin. So what medication are you going to give them? Correct medication with a correct dosage, please.
I didn't even know this was supposed
Are you spacing out on me?
to. Yes.
Drink some more Coke.
I'm like not here today.
You want to do some of those?
I'm at the body
I'll
shop.
pull it out. I've driven another. It's my Coke.
This recording is going to be trash.
Yeah.
Correct answer is sodium bicarb. Anyone who overdoses on aspirin or tricyclic antidepressants gets bicarb to help reduce the acidosis. Okay?
And you said we were going to talk about it in a minute.
Yes, and I said we were going to talk about it in a minute anyway.
Let's see the points.
I have one more question.
Last and final question. This drug is a sympathomimetic and is used in the treatment of severe allergic reactions. Sympathomimetic and is used in the treatment of severe allergic reactions. That's exactly what it is.
Where's vasopressin? Is that the choice?
Correct answer is epinephrine. Y'all are all so smart. Y'all ready to see who won?
It says you're all winners. I'm telling you, I'm gonna go crazy. Okay.
That's right.
What's the deal? We're not even on the board. It is team three.
We didn't bet. We didn't gamble.
It's the top 5 teams that are on there. So obviously team 3 and team 7, y'all are just awful. Team 7, bless your heart, you didn't have any points. And team 3, you maybe have 1,000. If that. Oh wait, no, you wagered and lost it all. Never mind. All right, team 5, good job.
What's our prize?
Do we get extra points on
No.
this quiz that we just took?
Yeah, we need a prize, especially if one of our team members is injured.
Now, next semester, for medical management, is the course that I teach you do in the summer.
You teach again?
You know what? Let me just stop this recording real quick.